Assalamu alaikum, the communication day. Your role is the doctor in the cardiology ward. Patient Mr. John, 68 years. The relative Mr. Edward, his son. The scenario, Mr. John present with complaint of severe chest pain with short of breath for the last 14 hours. His ECG revealed extensive anterior wall MI, myocardial infarction, and his echo confirmed the diagnosis with ejection fraction of 20%. Currently, Mr. John is having blood pressure of 70/40 with a maximal inotropic support. He is severely short of breath and saturation of 82 on oxygen therapy. He started on IV diuretics, but he is not tolerating it due to drop in blood pressure. Your consultant, because of his condition, decided that he is not candidate for angioplasty, and because also the deteriorated condition, he wants you to talk to the son about possibility of DNAR. Do not attempt resuscitation. Your task to sit with the son and discuss with him about Mr. Jones' diagnosis and currently his condition. Sorry, there is
قلبك المكسور سمي.
sorry. Okay, I will adjust the timer, then you can start.
All right.
Dr. Azhar, ready?
Yes, I'm ready.
Yes, here you go.
Hello there.
Yes.
I'm Dr. Zain, one of the doctor in the heart ward. Am I talking to Mr. Edward, son of Mr. John?
Yes.
68-year-old.
Yes.
Yeah, and I understand that you are the next of kin.
Yes.
Yeah. We are here to discuss issues related to your father health condition. Is that okay?
Yes, it's okay.
Yeah. Before starting, do you want anyone to attend the meeting with us?
No need.
We have taken the permission of your father to speak with you about his health status. And I want to know, before proceeding further, how far do you know about your father's condition to be on the same page?
Doctor, what I know that yesterday my father was brought in the hospital. He was having severe chest pain and shortness of breath. He was brought in the hospital, but after then nobody is telling me about the condition of my father. Please tell me what is happening with my father. I'm very much worried about my father's condition.
I'm really sorry for that. And any one of the team told you about his diagnosis, about what is going on?
Nobody told me.
No. And do you do any thought in your mind about what could be the reason?
I do not know, because you are the doctor who will tell me.
No one told you.
Yes, no one told me.
All right. So I'm really sorry for what you have been feeling of being so worried. Yes, your father came with a severe chest pain, and I'm afraid that I'm carrying a very bad news for you today, Mr. Edward.
What happened?
Yeah, actually, we did for him blood test and a heart tracing, and it showed that he has a myocardial infarction.
Doctor, what is myocardial infarction? I
Would
never heard.
you, all right, would you want me to explain?
Yes.
Yeah, actually, he has an extensive blockage in the artery, in the blood channels, I mean, supplying his heart, leading to a death in the muscles of his heart. Let me draw for you. If this is the heart, this is the blood channel supplying it. If there is any kind of a blockage here, if this is so extensive and so large, it might lead to a death in these muscles. I'm really sorry for carrying this kind of a bad news for you today, Mr. Edward.
Oh my God.
Are you with me now?
Yes, I'm with you. I was never expecting that my father will have heart attack. Doctor, so please do something for my father, because now I have heard that many new treatments have come in the medicine field, and that with the treatment my father will be okay. Please do something for my father.
All right. I'm really sorry for what you have been feeling now. Actually, yeah, you are right. There is could be like sometimes if this is myocardial infarction is not large enough, they and with a good outlook in the future, they may do like removing this blockage in the blood channel and dilating this blood channel in a procedure called angioplasty. Don't bother yourself with the term. They just make like a dilatation or putting a tube to let the blood goes to the heart. But I'm really sorry to tell you that in your father condition, the muscle has already died, and this affects the heart ability to pump the blood, and leading to the symptoms that he has. He has a severe shortness of breath. His oxygen in his blood is so low, and I'm afraid to tell you that after discussing his case with a consultant for his best interest, um, he is not a candidate for this procedure. Are you with me till now, Mr. Edward?
Yes, I'm with you. So you mean to say that there's no treatment, my father, and you will let him die?
No, it's not like that. I mean, if we did this kind of a procedure, it will add suffering, like a pain, subjecting him like to another medication, procedure, sleeping agent, and so on. And this would work with the people with a better stage of a myocardial infarction. But with his condition, it will not work. But we are not gonna leave him to die like that. We are gonna like support him, manage him in a group of specialized team, including the heart consultant, intensive care urine consultant, specialized nurse, and other, and monitor his condition very closely. And we will gonna update you about his case. Are you with me till now?
Yes, yes. Okay, if you cannot go for this surgery, then give some good medicine for my father so that he can be in a normal position.
Actually, this is was exactly had been happened. We started him on a because his because the heart cannot pump a blood. Let me draw for you. If this is the heart, this is the lung. The heart cannot pump a blood. The blood will go back to his lung, and his lung overloaded with fluid. And we tried to give him like peeing pills. We call it a diuretic to decrease this amount of fluid in his lung, but I'm afraid it wouldn't work. And even we give him a maximum medication that help the heart like to contract, but I'm afraid this also wouldn't work. And I'm afraid to tell you that his condition is now advanced, and it might shorten his life. Are you with me till now? I'm really sorry for delivering this kind of a bad news for you today. Really.
So you mean to say that sooner or later my father will die and there is no treatment?
Actually, anything can happen. People differ. Some people, there is all some people might improve as in a small percentage, but in his condition with this oxygen and this weak heart, I'm afraid to tell you it might shorten his life. But we are gonna follow him and monitor him, and because of this, our consultant labeled him that he will be possibly for not attempting him to be a resuscitated, possibly. Or,
What do you mean by resuscitate? What do you mean by resuscitating?
yeah. Do you have? I'm afraid you don't have any idea about this.
No, I first time I heard resuscitation.
Yeah, it means that if someone heart stop, will not do a heart massage. I mean, we'll not do like this heart massage, giving medication, connecting him to breathing machine, and so on. Because this kind of resuscitation will work with people with a better heart condition. But in your father condition, his heart is too weak to respond to this kind of a massage, and it will add nothing
2 minutes
to his
left.
condition apart from adding suffering to his. But this is only possibly. We are monitoring him. We are monitoring closely his condition. And if there is any kind of improvement, this decision of do not attend him to resuscitation might differ. But till now, there is a possibility of this with this poor, weak heart and this very low oxygen saturation. Are you with me, Mr. Edward?
Doctor, no, this time, if a time will come that his heart will stop, you will go for the heart massage. I want you to go for the heart massage.
I understand your feelings. Anyone in your place will ask for the same. But I'm afraid that this will add nothing to his condition apart from adding suffering. It runs without causing pain, without like fracturing his bones in his chest. It will add nothing but to his suffering. Are you with me? Until now, this is a possibility in this poor heart condition, poor heart condition and this low oxygen saturation, but we are following him and we will update you about this decision in the following days. Are you with me till now, Mr. Edward?
Okay, okay, as you like. I'm with you.
Yeah. Do you have any other concern?
No,
I would like to ask you, does your father have any wishes regarding this? Do not attempt to resuscitate. Has he any kind of a wishes regarding this topic?
no,
Has he like wrote some paper or like assigned someone on his behalf of a decision to refuse this kind of thing?
no, no. He did not. He did not mention anyone.
All right. Do you have any other concern till now?
No.
Again, I'm really sorry to deliver this kind of a bad news, a very bad news for you today. And I want to assure you that we are following and monitoring your father very, very closely. And we're going to update you about his condition every now and then, okay?
Oh, okay.
Okay, time's up. Thank you, Dr. Ruda.
Welcome.
Thank you, and well done. We will hear the comment from Dr. Azhar, and I will comment after him because I have a lot of comments. Yes, Dr. Azhar.
Dr. Ruda, you did very well. But I noted that you use jargons many times, like resuscitation many times. Instead of resuscitation, you can say heart massage. And then myocardial infarction, you can say heart attack. And then the peeing pills, it was not peeing pills, peeing injections. Otherwise, you did very well. And then now that Dr. Basam, he will comment.
Yeah, I think the same comment for Dr. Azhar about the jargon. You are trying to make it simple, but you make it very complicated. When you said the myocardial infarction, you make very difficult expression for him, and when you explain, you make it also more difficult. The blood blockage of the muscle and the infarction, because you started the wrong term. You understand it. So the best and the easiest word to say heart attack, and it was extremely or extensive or severe. Okay, you can say also life threatening because almost his muscle already, as you said, died, and after resuscitation and every trial to resuscitate him, or don't use resuscitation, we tried to save his heart and the rest of his heart. However, the patient didn't respond to the pills for the water or water pills. I don't know if written injection or water by oral.
Injection.
Anyway, injection, but still it's water pills. Water pills, no, not water pills. It's medication or drugs or medication for putting out the water outside the body to help to decrease the load over the heart. Since his heart is already poor and the muscle power of the heart being weak, we tried to do that. However, he didn't respond. You're supposed to finish this part early. This is regarding the delivering bad news, and it's supposed to be also with the warning shot and breaking bad news way, right? I think you did it, Dr. Roda, and this, I mean, this point particularly. Is it?
Yeah, you are right, Dr. Bas.
Yes, this is for the beginning. Then the part now for the NR. I don't know why you insist to make it possibly. Yes, it's possible, but this is your task. Why you make it changeable? We might change it. His heart now ejection fraction is 20-25 means, and most of the patient with this cardiomyopathy difficult to regain the power again, right? So better to mention it once. We will not change, or we will change, or we will not change. It's not written in the scenario. So you have to explain without going, sorry, without saying, is it possible to change the decision or no? His condition now, according to our consultant, decided to put him under a term of no heart massage. If you want to say it in your medical term, yes, DNAR. Don't bother about the name. It's it's a procedure, or it's a term we are using for poorly controlled patient for any condition, particularly like your father condition. When we have, or when the patient has the same features as your father facing, we are putting this decision in the best interest for him. Our aim in this condition not to let the patient suffer more, because of his already suffered a lot, and we will be supporting him and be sure that we maintain his dignity along with the comfortable care he needs in this time. Okay, try to be simple and not to complicate the things like DNR, and you try to explain it, but again you make it more complicated. This is my comment. I think apart from this, you did other things well. If anyone has comment or something to add, please do it. But I didn't prefer to say we will change it according to his condition, because it's not written there. Yes, it's possibly for DNR, but no one mentioned in the scenario that it might be changed after days or hours. Okay, Dr. Ruda, did you use
Yeah,
the
yeah, I totally
yeah,
agree with you. Yes.
yeah, did you use the inotropic support? I think you didn't use it as a weapon here.
I just told him that you are a maximum medication of medication that helps with his muscle to control, and there is no response.
Okay,
Yes.
so you used it. Okay, good. Yeah, yeah.
Yes.
Okay, so the let's give a score. Dr. Azhar, if you want for the clinical communication, you can. I think we can cut marks for the jargons, right?
Yes. Yes.
So at least or maximum you can get borderline, and it's not like non-satisfactory, but it will be, or unsatisfactory. It will be borderline because you explain well. I drew for you, by the way, Dr. Roda. You can use the arrow in the screen. You can use. Okay. Anyone also want to draw on the screen? He can just press over the pen and choose the color. Then he can draw, and be simple while drawing. Don't make it complicated. I draw very simple diagram for the heart and two blood channel, and a big clot. It can block one of the heart or blood channel. So this is for the clinical communication. For the clinical judgment, yes, she did. I think she judged the case well. Uh, Apart from that, the concern and welfare, yes, supposed to ask earlier about the advanced directive, and better to say if he wish or he express any wishes regarding his medical condition, not for DNR itself, how he wished to be, not to be resuscitated. So instead, you can say, did he express any wish regarding his medical plan in the future? Okay. Don't specify DNR, because no one will know about DNR or heart massage. Not all people, I mean, unless they have a card for that. So I think this is
Yeah, there is
the
someone wrote in the chat box that DNR is a decision of a treating team, so better not to ask about patient decision. No, we will ask about patient decision. Why? Because
yeah. It
patient
might
has the
be
right to refuse,
yeah,
not to
yeah,
ask.
Yeah, it might be with the medical decision. It might go with the medical decision. So it will be ease the scenario.
Yeah.
Yeah, it's. I think no. I agree with you, doctors. DNR is a decision. Of course, it's a decision. But if the patient himself
Refuse, yes.
wish for that, it will be very easy to explain it, and we are respecting his wishes because we are here in the best interest for the patient, and we want all patient to be comfortable. This is our aim in the hospital, and this is our aim of management. Okay, so better not to ask. No, I think we have to ask here because this is the time to ask. The patient might die after a couple of hours. If the patient himself asks for that, it will be more easy for the medical team to proceed with the DNR. Plus, even they might withdraw the medication. If, for example, the patient express, I don't want to be connected to a machine. I don't want to stay in the hospital. I want to die at home. All these things will make the decision very easy to let him go home and die at home with his family. So it might be with him. Okay. Uh, let's go to the next scenario.
So
Yeah,
the
don't
group.
yes, okay. Don't forget, Dr. Rhoda, extensive MI, heart at,
Extreme.
heart attack,
All right. Sure.
and the
And
stroke
I need to
also.
prepare something. Yes.
Yeah. Hello. Anyone commenting? Okay. I will read the second scenario. Um, Mr. D. Silva was admitted to the acute medical unit 2 days ago following a 5-day history of diarrhea and vomiting. He has been a soldier in the army for the last 4 years. He has recently returned from overseas for a period of home leave. He had been out with friends celebrating 21st birthday the day before becoming unwell. The diarrhea quickly settled, but he continued vomiting until the day of his admission. Upon arrival to the ward, he was lethargic and dehydrated. His blood glucose on admission was 38.6. He was diagnosed with type 1 diabetes mellitus and diabetic ketoacidosis secondary to viral gastroenteritis. Your task: speak with Mr. D. Silva and explain the diagnosis of type 1 diabetes. Good scenario. Okay. Dr. Azhar, I will give you 2 minutes. We can hear the comments from others. Dr.
Yes.
Aisha, you were talking. Sorry for interrupting. Dr. Aisha, you want to comment?
Not me.
Okay, no problem. Anyone has comment, please feel free to comment. Any comment regarding the previous scenario or any communication scenario? When you're ready, Dr. Azhar, let's know.
Okay.
Okay, ready?
No, no, one minute. Because
Okay.
it is lengthy and very small, I am taking time to read it.
Ah, you didn't read it yet? Okay.
No, no, yes.
Anyway, the task mainly to explain about type 1 diabetes.
Yes,
And yeah, in summary, patient present with DKA after gastroenteritis, and he found or recently diagnosed as type 1 diabetes.
okay.
Put a scheme and
Yes,
follow
yes,
it.
we can start.
Sorry.
Yeah.
Okay, waiting for Dr. Azhar, Dr. Rhoda.
Mm.
Hello,
Yes,
can you
hello.
start? Now, are you Mr. Diselva, 21 years?
Yes.
I'm Dr. Azhar, today
Mm-hmm.
one of the in charge in the gut department. Uh,
Mm.
Before we start, today we are here to discuss about your health. The problem is that okay with you?
Yeah, please.
Okay. Before we start, do you want anyone to accompany with you?
I'm Cameron. No, I'm not on camera. I am now in my room alone.
Okay. Okay. Before we start, I just want to know
Mm.
uh, how much do you know about your problem?
Yes, doctor. The issue is I was celebrating my 21st birthday party with a family. And then after returning home, I developed this loose motion and tummy pain with throwing up. I think I drank a lot of alcohol this day, and also I ate a lot of kebab. I think that is why I had this loose motion and throwing up. But actually, the loose motion improved, but I continued like to throw up and had this tummy pain. And I'm really concerned because a lot of medication had been given to me and something. It's I don't know what's going on.
Okay. I can understand your conditions. I'm sorry for that you are still
Yes.
having
Mm.
suffering from sickness and throwing up.
Mm.
Okay. Before I proceed, I just want to know what are your expectations today?
I expect it like to be like a gastroenteritis simply.
Okay. So after reviewing your condition, the I the conditions of which I came to know, we were not hoping as we were hoping that it's not good that I don't have a good news for you.
Uh, what? Just tell me, doctor, what is going on?
Because after doing investigations, we have found that you have diabetes type 1. Have you heard about this? Hello?
I think one of my cousins has this. I hear this term, but if you could explain to me, I will be very grateful.
Okay, okay. I just want to explain you.
Mm.
You see, I'm just not drawing for you
Mm.
because in our tummy there is one gland which we call in our language is pancreas.
Mm-hmm.
So your gland is not working normally
Mm-hmm.
right now. Why? Because you're normally we have a defense system. It normally
Mm.
attacks bugs, but in your
Mm.
case,
Mm.
your defense system mistakenly attacks this gland, and due to
Mm.
by attacking this gland,
Mm-hmm.
your gland is not working normally, and due to
Mm-hmm.
this, the function of this gland is to produce a chemical which we call in our language is insulin. So
Mm-hmm.
so this chemical insulin is not producing in sufficient amount, and that
Mm-hmm.
because of this, you are having this problem of loose motions and throwing up and sickness. Are you
So
with me?
you mean these chemicals cause a gastroenteritis?
No, no. This chemical did not cause the gastroenteritis. Actually, your condition has been aggravated by a viral infections,
Mm-hmm.
by by some bug,
Mm-hmm.
and this bug has aggravated your conditions. Actually, the underlying condition was diabetes, and this bug aggravated your condition. And due to aggravation of the your problem, you are having loose motion and tummy pain and throwing up. That's why you are not feeling well.
Okay,
Uh,
they told me that I have a very high blood sugar. Is it related?
Yes, yes, it is related with your gland, because when your gland will not function properly, what happen? This hormone will not be released in a proper amount, or it will be in a very low amount. So your blood sugar will be very high in your blood, and the function of this hormone is that it will push the extra amount of the glucose in your muscles. When this hormone is not present or present in a very very low amount, this extra blood sugar, it will not go in your muscles, and it will remain in your blood, and that's why it is causing problem for
Mm.
yourself.
All right, doctor. All right, doctor.
Is
So,
that okay with you?
is it like a treatable, doctor?
uh, I, I can understand your condition. I'm
Mm-hmm.
sorry to say that this is not a treatable condition, but we
Mm-hmm.
can manage it with the uh, keeping you under regular follow-up, and
Mm-hmm.
with multidisciplinary teams like gland doctor and diabetic nurse and specialist doctor, we can manage your condition, because this
Mm-hmm.
condition can affect many parts of your body. It can affect your heart, it can affect your kidney, it can
Oh
affect
my
your
God.
eye, it can affect your legs, nerves, brain,
Um,
any part of the body it can affect. So we will keep you under close monitoring, and we will have a regular follow-up, so that you cannot develop all these complications. Is that okay with
so,
you?
all right. So, what kind of a medication that you will give me?
So at this time, we the medication we will give you fluids, so that we can hydrate you,
Mm-hmm.
because with diarrhea and throwing up, you have lost the fluids. So now at this time, give you fluids, and after
Mm-hmm.
then we will start you some medicines, and
What
most probably this
what
medicine
kind
will
of
be insulin.
medicine?
Insulin, we will start insulin to control your problem.
Mm. So,
Is
all
that
right.
okay with you?
So, you will give me this kind of a medication oral
Uh,
or
you
will
see,
discharge? Mm.
okay, the condition is that in your condition, as I told you, that in your condition there is a very little amount of insulin,
Mm.
so the medicine will not have a very good role. So in your condition, insulin injections, they will be better for you. Is that
So,
okay
doctor,
with you?
why giving me injection? Is there like any insulin tablet? I mean.
There are actually no insulin tablets, but there are we
Mm.
have some medicine which release the insulin from this gland. But
Mm.
actually, in this condition, almost the insulin has been depleted. There is no insulin, or
Mm.
if there's insulin, very little insulin. So if we will give medicine, there will be a tablet. There will be very very little effect. So better in your conditions, injections will be better for you. Is that okay with you?
All right, doctor. All right.
Do you need
Two
any?
minutes left.
Do you smoke?
No, I don't smoke.
Do you drink alcohol?
Just on social occasion.
So it's better for you if you will stop alcohol, because it will also disturb your problem. If you
Mhm.
agree, I can refer you to the Alcohol Anonymous Clinic. Is that okay with you?
All right, doctor. All right.
Okay. Uh, do you drive?
Yeah, I try.
Okay. Unless we will not sort out your conditions, it's better you will hold on the driving,
Mm.
because at this time your your sugar level is very high. So
Mm.
unless we will not solve the problem, it's better that you will hold your driving. Is that
Mm-hmm.
okay?
All right. As
Okay.
you.
Do
Mhm.
you need any help from our side?
No.
What is your job?
I'm a soldier in the army, doctor.
Oh, okay. And how it is affecting your job?
I don't know, doctor. You make me afraid now with taking this injection.
Okay, what we will do, we will
What
have a
is
meeting with
the
you.
drawback of this injection, doctor?
Okay, there are many drawbacks because sometimes you have your sugar will be very low and you will feel shakiness and racing of the heart and
Mm.
sweating. So we will give you some leaflets and brochures about all these problems. You can read it, and if you have any query, any problem, you can contact us anytime. And if you have like these symptoms like shakiness of the hand, jerky movements, and sweating, racing
Mm.
of the heart, you can
Mm.
contact immediately with us. And moreover, we will also involve the specialist diabetic nurse. She will teach you about all these complications and the signs and symptoms of this disease. Is that okay with you?
All right. So,
Do you
doctor,
have any other concern?
yeah, what about my job, doctor? Do I need to tell them that I got this diabetes?
No, okay, you can inform them, and I think nobody will turn you from your job, because when we are doing any job, and if you develop any problem, any disease, we are legally bound to sign the health declaration form, and it's better to inform your employee, because if
Mm.
at your job, if you develop these signs of low blood sugar
Yeah.
with insulin, they will take better care of you. It's better if you will inform, and nobody will keep you out of the job. Do you have
All
any
right.
other concern?
No, not really, no. Thank you.
Okay,
Okay, thank you
time's
very
up.
much.
Thank you. Well done, Dr. Azhar. Thank you. Dr. Rhoda, please, you can comment.
No, you did great. Just a few comments.
Yes, please.
Jargon, glucose, and hormone. And uh, you should teach him earlier about the low blood sugar symptoms. And just tell him about the drawback of this insulin. The main thing is the low blood sugar and the side effect. And yeah, so like a like the alarm of the hypoglycemia and the diabetic ketoacidosis itself. If you got this tummy pain and throwing up again, you should contact the emergency department at once and measure your blood glucose. And regarding the job, I think he will be prohibited from being a soldier, but I don't know if there is like any update. This book is old. It's not a new one. If anyone will update, okay, but it's written here it will be prohibited. So you need to tell his occupational health worker department. Um, yes, apart from that, nothing. I don't know virus if it's a jargon or not, but you told glucose and hormone. That's it.
Yeah, well done. Thank you, Dr. Rhoda, for the comment and the scenario. Okay, I agree regarding the last point, which is military forces. He will not be fit enough to work in it. So the best thing is to refer them with a report, and they can decide either he can do or no. But probably yes, he will not be fitting with this job because of the possibility of having hypoglycemic attacks while doing his activity. This is for the last point. Before that, Dr. Azhar, that always remember the diet, the exercise, and the counseling education about the insulin. You missed the exercise totally, right? You didn't say anything about she has or he has to have regular exercise daily for at least 30 minutes, right?
Yes,
This
yes.
is very important in any diabetic patient. As you explained for the hyperglycemia complication, you have to explain for the hypo earlier, hypo. Because the most serious complication is the hypoglycemic. And even you can tell him it might lead to serious condition, might harm your life. And I read also one comment about any partner with you, yes, to be careful about the possibility of complication. And the bracelet also, as insulin user patient, I think here also can be raised to educate the family and the friends about the possibility of having hypoglycemic attacks, which might be presented with sweating, shakiness, and up to coma. This is for the hypo. For the hyper, you mentioned, I think, high blood sugar, but also don't miss the DKA as a serious complication. You have to be compliant to your insulin, to take it on time, and don't take insulin without eating the meal, and the opposite. Don't take the meal without taking the insulin. Both of them are dangerous and they might lead to a complication. So be sure that whenever you are eating or going to eat, take the insulin, and whenever you take the insulin, you have to eat. Okay? This is the
Okay.
most important thing. The driving you address, which is good, but better to ask what type of vehicle is it, your car or, because this is also another issue for the DVLA. And the best thing here is to refer him or to refer the patient to DVLA. He should inform the DVLA. I need from you to inform DVLA because if you have any attacks of hypoglycemia, you might be unable to drive. I'm sorry to say that. Okay?
Oh, okay.
This is the points need to be explored. And for the first scenario, Dr. Rod, I missed one very important point. You invited someone, and the same time you said, I took permission from your father, which is not fitting for the confidentiality. Once you have a confident patient, sorry, a competent patient awake, and you took a decision from him to talk about his condition with the son, you cannot invite someone else to hear about this meeting and about the father condition, whosoever. Okay, so you have to talk to one person only. This is one of the confidentiality issue. What if this son told you, yes, can I bring my friend, my cousin? So the best thing is to say, I assume I have consent or a permission from your father to talk about his condition, but don't invite anyone. This is the solution. Okay. Any comments or Dr. Azhar? Or any comment or question, Dr. Azhar?
Should I comment or someone else comment?
Here, he is one, the son itself, he's talking to the patient. So she can invite
Which scenario? No, no, I talk about first scenario, not
the
second
first
scenario.
scenario.
You
Because
can,
second, I
can
think Dr.
No, no,
Azhar
no.
also invite. Yeah.
Yeah, he can
Okay.
invite in second scenario because the patient himself can invite anyone. Okay, but don't make third party. I always say this rule, Dr. Aisha,
If
if you
the other,
remember.
yes.
Yeah. So the second person, you will talk about the first person. Don't invite for a third person.
Yes, this is a must. This is
Yes,
confidentiality. Yes.
yes,
Yeah.
yeah. This is for the first scenario. Sorry, this advice supposed to say it with Dr. Roda scenario, but I missed. But I remember during second scenario when Dr. Azhar invite, I remember this issue. But thank you for reminding Dr. Aisha. Any other comment, Dr. Aisha, for this scenario, for the hypoglycemia, hyperglycemia?
Just for the pump and the machine to monitor the blood sugar for you, because she said I have fearing from injection like that, and for
I guess for the first meeting, at least now you can
just
talk.
you can
If
talk
he
like there
reached
is
to this
other
level, yeah,
options, and
yeah,
we will make
I
it easy for you like that. Mm.
I agree. But in the first meeting, I think he has a lot to talk about, like
Because she
education.
mentioned that
Okay, if she
uh,
said yes, if he or
it is
the
concern.
surrogate,
Yeah, yeah.
yeah, if he ask, please, I have fear of injection, I have problem, I have phobia, you can address this by the pen first. If still he has a problem, you can offer it at the end as option. It might be in the future because also not every patient will have this pump. Okay, if he ask any other option, doctor. But for the medication as oral, no,
Yes,
it's not.
yes.
As Dr. Azhar said, insulin only the only solution for your condition. You have to take it, and we will teach you. And you have to invite a nurse here, Dr. Azhar. She will teach him how to inject herself or himself. Plus the dietitian, as Dr. Rhoda said, you can invite also the dietitian to give him some leaflet and sure about the diet and how to control his diabetes with regular regime. Okay.
I involve the nurse, but I forget to involve the dietitian. You are right.
No, no worry. It's okay. Any comment, Dr. Aisha, else?
No, thank you.
Okay, Dr. Fazil
Well done,
Rahman.
doctor.
Yes, thank you, Dr. Aisha. Dr. Fazil Rahman wrote, check with whom he's living. Yes, I agree. Living alone is hazardous, of course. Need job modification, yes, because this heavy exercise might lead to a lot of hypoglycemic attack. So you can refer him to the occupational, or you can provide him with a report or fitness paper. He can be referred to his occupation at his company, and he can decide about that. He has a risk to have hypoglycemic attacks while he's on his job. Usually in military forces, diabetic person cannot continue the job. Suppose if it is optional job, but I think some of them they can be replaced and they can do office job. Office job, they can reallocate him. It will be more easy for him. But for running and marathon and doing the other position apart from the office, no, I think it will be difficult. Yes. Usually yes, mention pump option also machine. Yes, okay. You mean the CGM, continuous glucose monitoring, to monitor the blood sugar. Dr. Azhar did great. Yes, we can ask for hobbies for modification. Yes, of course. I think this scenario is very large scenario to reach to the hobbies. If you finish early, you can of course ask about it and address it. But for this scenario, to explain the diabetes and to explain the insulin and how to use the complication, and Dr. Azhar also had explanation here about the pathology of the disease. I don't know, Dr. Azhar, if all type 1 diabetes is autoimmune, destruction of the pancreas, because you mentioned it. You said
Yes,
defense
it is
system,
a diagnostic test to diagnose type 1. They should do the autoimmune antibodies. But
autoimmune
it
to
is
the.
different antibodies, but it is there is the positive autoimmune will diagnose you as type 1.
He
Okay.
is right. He is right.
Yeah. So mostly or mandatory to be at an
But just
autoimmune.
he making it more deep.
Yes, yes, I think
يعني
so.
I think
Yes.
it can be more simple that your pancreas will not produce the substance responsible for your sugar uptake or like that, and it is with unknown cause that the defense system attack your body. I think because you mentioned that and you forgot to relate it to the sugar after
Yes.
mention
And
all
Dr. Yeah,
the
Dr. Roda remind him. Yes. Dr. Roda remind him. So
yes yes
why blood sugar high?
because
Yeah.
if you go more deep you should start with the problem itself. You have diabetes, so this means this you have high blood sugar because you don't have substance that making uptake this sugar from your blood. And if you
Or
will go deep
burn.
after that, or she will not understand the other things, it's no
Yes.
problem. Just she should understand this issue about the sugar only.
Yeah. I think also we can say break down the glucose or burn your glucose in the blood. That's why your blood
Maybe,
glucose is
yes,
high.
yes. Uptake or burn or
Because Dr. Azza also mentioned should be in the muscle, but deep explanation, I guess
yes,
also
in
as Dr.
communication you will be is the
Yes,
and you
yes.
will see the surrogate or the patient like confusing.
Of course, he will ask more and he will put you more question. No need, just be simple as much as you can and try to jump to the other task, which is insulin in this scenario. Plus the complication, what might happen if the patient either took insulin or he missed the insulin. DKA, as what the patient presented with, one of the complication along with the hypoglycemia if the patient had insulin without meal, and you can add also the point of stress, the infection.
Yes,
All
the hypoglycemia here in this scenario very, very important. They making it like the safety netting of these patients.
yes,
So
welfare, yeah,
yes.
for the welfare. Okay, Dr. Azhar, any question from you, Dr. Azhar?
No, no, no.
Okay, and Dr. Rhoda, any question?
No, thank you.
Okay, thank you, Dr. Rhoda and Dr. Azhar, for these both scenarios. Anyone has comment?
Yes, hi, Dr. Basim. Hi, everybody.
Uh,
I just, I
yes,
just would
Dr.
like,
Iman.
I just would like you to emphasize another time the point that I had not the right to invitate anyone who is a patient, who I can invitate and who not. I didn't get it. I didn't get it yet.
Okay, simply, if you are talking to the patient himself and you are going to break bad news, counsel about dangerous disease or about complication to the disease, a cancer, in this time, if you are talking to the patient himself, you can invite someone to support him. Okay, this is for person or patient himself. Let's assume there is another patient, and you are talking to the son or the daughter, and the patient himself is conscious. First of all, you have to assume that you have a permission from the father to talk about his condition. Once you have a permission, you cannot invite someone else to talk with the son or to hear this discussion. So don't invite in this scenario. Okay? The
Yes,
third scenario, the patient is comatose. Okay, and you will talk to the son or daughter, comatose or going to die, like the first patient. No, not the first patient. Let's say going to die and he's comatose. I mean, lost capacity. Here you can also invite someone else because you already lost the patient capacity. What I mean, if you have a third person will be invited, don't invite him. But if you are talking to the second person, okay, you can talk to the second without inviting the third. But if you lost the patient and you can invite another person, consider the patient himself now lost the capacity, so you are still talking to the second about dead person or about comatose patient. So you can invite to help him to absorb this breaking bad news. You got it?
yes, I got it. So if the patient is conscious,
Yes. You
I
will
have to ask
assume
him. Yes,
you will assume, not ask. You will assume that I got permission from your father to talk about his condition,
yes,
and you cannot invite. There is two
yes,
scenarios in basis you cannot invite at all, or three scenarios, which are HIV patient. It's very top confidential. You cannot invite anyone. You are not
yes,
allowed to invite. Second scenario, patient with suicidal attempt. It's prohibited to tell him, can you invite? Because she's the one doesn't want anyone to hear about her condition. This is the second
yes,
scenario. The third scenario, some genetic disease or some congenital disease which is embarrassing, like Huntington or myotonia or some disease. The patient himself doesn't want anyone to know about it. How you can invite, right?
yes, yes, you are right. I
Yeah,
get you. Thank you so much.
yeah. Most welcome, Dr. Iman. Thank you. Any other question?
Yes, please, Dr. Basim, regarding to the newly diagnosed diabetic patient, we should inform the DVLA even if he
Sup-
has no still high blood
Suppose,
pressure.
yeah, yes, good question. Thank you, Dr. Phoebe. Suppose not to ask or not to refer unless he has hypoglycemic attack. Okay? If the patient has single hypoglycemic attack, he should be referred. But in this type of patient, for the first meeting, you can tell him, please, if you feel or if you have any hypoglycemic attack in the future, you have to refer the guidelines for DVLA because they have strict form and guidelines for such kind of disease. Okay, and once he has the hypoglycemia, Awareness, of course, because an awareness, a hypoglycemia is absolute contraindication or absolute prohibition to drive. But for the first attack of hypoglycemia awareness, he should stop driving for a couple of months before he resume it back if his blood glucose is controlled.
Okay, thank you.
Most welcome. But for the first time as education, you can tell him, if you are driving, please be sure that your blood sugar is okay. If you are feeling hypos in the future, it's safe not to drive and to be following with DVLA. This is for your safety and for the patient's safety as well, because you will get marked for the welfare. You have to explore and you have to give him education about the hypoglycemia and the driving. Okay. Any other question? Any comments?
Yes, doctor, I have comment. I'm Dr. Ibrahim.
Yes, Dr. Ibrahim, go ahead.
One simple comment regarding treatment. The doctor did explanation well for treatment, but as you mentioned, he didn't mention insulin pump. One more thing, he talked about oral hypoglycemic. I think in the scenario it is already mentioned type 1 to save your time and to just tell him directly about insulin or other choices. Insulin by injection or insulin by pen or insulin pump. You can go through this track.
Yes, yes.
No need to go through this oral hypoglycemic because already I will not tell him there is other insulin, but in your condition, we are not supposed to give you this medications.
Yes.
I'm not sure about this, but I mentioned.
Yeah, thank you, Dr. Ibrahim, for your question. And I always encourage people to share either comment or question. Thank you for question again. Let me explain to you and clarify the things. Dr. Roda, the one asked him, is there any option like medication I can take by oral? And he answer here. So he didn't raise it by himself. She is the one raised, and he answered here that it cannot be in your condition. For the insulin pump, I agree if the patient have phobia, but it's not an option as initial option now. We can mention it if he asks, what else? What else, doctor? I want to be living my life without injection. Yeah, now that time you can tell him there is an option called insulin pump, and it's supposed to have test or to refer you to check if you are a candidate for this pump or no. But anyway, you can enumerate the types of insulin, as you said, injection or a pen, or also there is a pump, but not in details because the scenario is very large. As I said, you can explain a lot of things, the complication, the warning, the also the hobbies, the family, and the job, the smoking, alcohol. You have to express all these things in the scenario. Okay.
Okay, thank you, doctor.
Most welcome, Dr. Ruben. Thank you also for your comment. Any comment else? Okay, if no more questions, we can end the session. Thank you, everyone. Thank you, Dr. Azhar and Dr. Roda, particularly. Inshallah, tomorrow with another day, clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.